Okay, moving into the femur and the tibia and fibula. So we're in the appendicular skeleton, and we're looking at the lower leg here. So our femur, longest bone in the body, strongest bone in the body, extends from the hip to the knee. So up here at the head of the femur, this is where it's going to fit into the pelvis, and then down here, this is going to articulate with the tibia down at the bottom part of the leg, or excuse me, of the femur. So the a femur is kind of your typical bone, right? Looks kind of, it's your long bone, has two epiphyses that are enlarged at either end, and a very long um, axis. That's the diaphysis. So this is basically the typical bone that you would think of, your dog bone or whatever. Some parts that you need to know here. And again, you're not going to have to know all of this stuff, but go over it real quick with you. First of all, the head of the femur, real important here. And as you're looking at it on the bone, it's easy to see. This fits into the acetabulum of the pelvis. So if we go back to here, remember this structure here is the acetabulum, that depression on the pelvis. So the head of the femur fits right into that. Gives us a really versatile, flexible ball and socket joint. Notice how right underneath that you have the neck of the femur, this constricted portion or smaller portion. Think of our neck is a little bit smaller than our head. Same thing here. Reason that's important and physiologically that's important is this is an area where if you think of a senior citizen that has fallen and they've broken their hip, it usually happens in this area right here. They've cracked the neck of their femur. That can be really debilitating for somebody that might be a little bit older. You have two big structures just underneath the neck. You have the greater trochanter and the lesser trochanter. Um, these, again, I've said this a lot with a lot of structures. These are just basically muscle and ligament attachment. Um, if you really look up all the things that attach to the trochanters, you'll see a group of muscles. So, like some of the gluteus muscles will attach there and other things. So, very physiologically important. In between them, in between the trochanters, we have this thing called the intertrochanteric line. It's kind of like somebody played connect the dots here. And again, that's a site of ligament and muscle attachment. Um, and that's really all you need to know up at the top of the femur. I'm not going to ask you about the gluteal tuberosity or the intertrochanteric crest. However, it is important when we start to figure out, is this a right or a left femur? Um, Keep in mind that the head of the femur will always point medially. So, if it's going to point towards the middle of the body because it has to connect to the pelvis. Okay. Down at the bottom, there's a little bit more stuff. So I'm going to start with the medial and lateral condyles. Really, if I were to take this femur and turn it so you can see the very bottom of it, it's these rounded things. So you see one here and one here that will articulate with the condyles of the tibia. Okay, so these things sit right on top of the tibia. And if you remember, there's a piece of cartilage between them called the meniscus, which is a fibrocartilage pad between those two where that articulation occurs. So you have medial and lateral condyles that articulate with the tibia. Then you have right above those, you have medial and lateral epicondyles. These are smaller bumps, and they're above or they're superior to the condyles. And they again, keep saying it. These are just attachment sites for muscles and ligaments. We're not going to be responsible for which muscle or which ligament is going to attach there. But keep in mind that the condyles are at the very bottom of the femur, whereas the epicondyles are these little bumps kind of on the side just above those. There's this thing called the trochlea. You can't. It's not labeled on here, but you see it says patellar surface. There's this little depression right in here um, where the patella is going to sit. That's called the trochlea. So similar to the humerus that had a trochlea, our femur has a trochlea, and that is going to basically house and articulate with the uh, patella or the kneecap, and it's going to kind of glide within that joint. On the very back of the femur, we have this big notch between the medial and lateral condyles. It's called the intercondyloid fossa. Here they call it the intercondylar notch. So really the same exact thing, intercondyloid fossa or intercondyloid notch. It is a notch or a depression between both the condyles. This is where your cruciate ligaments are going to pass through. Now, when I say cruciate ligaments, if you think of the anterior and posterior cruciate ligaments, or ACL and PCL, they're going to go right through that notch. Excuse me. They're going to go right through that notch, and they are going to connect to the tibia underneath them. All right. So that is your femur. Now, your femur is going to come down. It's going to connect to the tibia. So the large bone in the bottom part of your leg is the tibia. Small bone on the outside or the lateral part of your leg is your fibula. I always said, and I think I told you this last unit, easy way to remember which one is the big one and which one is the small one. I always heard my anatomy teacher said it's like a little fib or a little white lie. So that little fib is the little bone on the bottom part of your leg. Your tibia is your shin bone. So you can actually feel your shin bone going down that front of your leg. It's one that people get injured quite a bit. What parts do we need to know on the tibia? Well, just like I had a medial and lateral condyle of the femur, I have a medial and lateral condyle of the tibia here and here and here and here. So the femur is going to sit right on top of those condyles um, of the tibia, and these are actually kind of concave or little depressions, whereas the condyles of the femur are convex, so they're kind of rounded out, and they'll fit right into the condyles of the tibia. Forms a nice, neat joint for us. You have this thing called the tibial tuberosity. It's this bump right on the front of the tibia. This is an attachment for the patellar ligament, or the patellar tendon. So your patellar member is a sesamoid bone. It's going to be sitting right in here, and it's contained within this tendon, which is going to extend to the patellar ligament, and it's got to attach to the tibial tuberosity. At the very bottom of the tibia, actually, let me go back up here. You have this thing called the intercondylar eminence. See these little extensions, they kind of stick up. That is actually going to fit into the intercondyloid fossa on the femur. So there's that big opening where the cruciate ligaments are coming through. Those cruciate ligaments are going to stick right into this area, this intercondyloid eminence. Okay. At the very bottom, we have something called the medial malleolus. Okay, medial malleolus. This is an attachment site for muscles, or excuse me, for ligaments of the ankle. And this is a huge bump on the inside part of your ankle. You can actually go down there and palpate or feel that large bump on the inside part of your ankle. That's really all you need to know for the tibia. Okay. As far as the fibula, this long, slender bone going down the lateral portion, lateral meaning on the outside, lateral portion of the bottom leg. First of all, you have the head of the fibula. The head of the fibula is going to basically sit right underneath the lateral portion of the tibia. So I have the lateral condyle here. It sits right underneath that lateral condyle. So the fibula does not articulate with the femur. So all of your weight as you're walking is going right down onto your tibia. Down at the very bottom part of the fibula, you have the lateral malleolus. Okay, the lateral malleolus is a large bump on the outside portion um, of your leg, and it's another one that you can feel. And it's going to articulate with with your tarsals. Both these malleoluses are going to articulate with your tarsals, which are ankle bones. Okay, not a whole lot to know about with these two bones. One more thing I'll point out, and you can actually feel this. We have this thing called the crest of the tibia. Your tibia actually kind of comes to this like triangular ridge that sticks out, and you can feel that crest going right up and down your shin bone there. Okay, so that's pretty much it for that. Some of these other things that are labeled, you don't need to worry too much about, but these bones are pretty simple.